Welcome to All Things Cardio-Oncology. My name is Steve Caselli. I'm the Executive Director of ICOS. And in this podcast, you'll hear from a diverse representation from our community. We want you to be both informed and inspired by their stories and experiences, and we're so glad that you've joined us today. This is Steve Caselli, Executive Director at International Cardio-Oncology Society, and I'm at the Memorial Sloan Kettering Cardio-Oncology meeting here with the president of ICOS, Dr. Mike Fradley, and one of our board members and good friends and colleagues, Dr. Alex Lyon from Royal Brompton, UK. Alex just gave a wonderful summary talk of the top 10 cardio-oncology articles over the last decade, which was quite a feat to develop that list. So Alex, tell us a little bit about your talk.
Thank you, Stephen. Yeah, it was a real honor and privilege to be invited to speak at the Memorial Sloan Kettering meeting. But when I received the invitation to give this talk, this was quite a challenge. There's been a lot published in the last 10 years as there's been a real explosion in this field of cardio-oncology, and I could have easily picked 20 or 30 excellent papers, particularly some from Mike, which I had to exclude, unfortunately, when I trimmed down to the top 10. Well, what I wanted to do is focus on original science, so I did not pick any guidelines or position papers. I really wanted to promote and emphasize the importance of randomized controlled trials, so I included several important RCTs, or where papers have changed my practice, and going forward, I think that's a really important message. I decided to exclude my own papers as well as Dr. Fradley's, and decided not to succumb to the temptation to give 10 papers from Memorial Sloan Kettering's team either. As I go through and discuss these, I apologize to the listeners if your papers are not included in my top 10.
Well, Alex, it really was a enlightening talk. And as Stephen and you've already alluded to, this is an incredibly challenging talk to get because there really are so many important and impactful papers that have been published. I'm really curious, how did you go about identifying the articles that you found to be most impactful? And if you wouldn't mind talking about a few that you found especially important.
Yeah, so I think when we get invited to do talks, you go and read around the topics, and you slowly over the years, in your memory, and the papers that really did make a difference to how you could sort of design and consider both your clinical practice and delivery of care in your own clinics. And of course, when I had the privilege to chair the guidelines, we reviewed a lot of the articles. And so when we think of this 10-year window, a lot of them has been reviewed in depth at the time we were constructing the guidelines, but then they're also important papers since. So I think there's a range. And then the other thing I did is went to all my fellows and consultant colleagues at the Royal Brompton Hospital and asked them to tell me their one favorite paper from the last 10 years. And it was interesting to see the range that they shared with me, and some of them overlap with my thoughts. Sometimes they showed a paper in a different light to me and made me realize the importance of it. So I brought that all together.
Fantastic. And at the very end of your talk, you showed a really enlightening slide in which you compared your list to AI. Because that's obviously something that a lot of people utilize to create these lists and to identify various answers to questions. So tell me about how the two lined up between you and what AI told you.
Thank you, Mike. Yes, so we've all got a new member of our cardio-oncology teams called Claude. So I went and asked Claude, and I put in the criteria which I stipulated: no guidelines, no position papers, none of my own papers, and then saw what it created. And there was an overlap of 3. So 3 of my papers were also included in Claude's list, but Claude was very biased. So 6 of the papers were on immune checkpoint inhibitor related toxicities, very important, but not really necessarily the most important. And 4 papers came out of the SUCA trial program. Again, very important, but I included the original SUCA trial, but not SUCA MRI or the 3-year follow-up. So clearly Claude was biased by maybe the chat on Google and other ways, because it wasn't purely about citations to generate its list, but it shows maybe that AI still has something to learn from the experts.
good to know that we still have a role here. In our last few moments, are there any specific papers that you'd like to highlight for our listeners in your top 10, which we will say is the correct top 10, and Claude is going to be the secondary option?
Yeah, well, I think I covered various topics. I'd like to really highlight the paper from the St. Jude Lifetime group on the rate of cardiovascular disease in childhood cancer survivors that was published in Lancet Oncology in 2024, because it shows this phenomenal finding of a 17.7% rate of major adverse cardiac events in the follow-up at 20 years compared to less than 1% in the control group. So this enormous burden of heart disease in childhood cancer survivors. The second is the paper from Teresa, where she showed the accuracy of the HFA-ICOS baseline risk assessment score that we've recommended in the guidelines at predicting not just cardiac outcomes, but also overall mortality in the high-risk group, but also showing the safety and lack of problems in the low-risk group. And finally, I discussed several randomized controlled trials, and I think the cardiac care trial really showing that there is not a role for using high sensitivity troponin monitoring patients in low risk group is really going to change the guideline approach now, that we shouldn't be recommending troponin monitoring in low risk patients receiving anthracycline chemotherapy. Those are just some of my highlights.
That's great. Well, Alex, it really was a pleasure to have this opportunity to talk with you. This was an incredibly enlightening talk for all of us. And certainly, we could redo your top 10 list and include some of your own incredibly impactful papers in it as well. So perhaps that'll be our next conversation, a top 10 with yours included. So thanks for all that you do for cardio-oncology in this organization.
Thank you, Mike. Maybe we should do a top 10 of yours and mine. And this is certainly a topic, maybe we should think about how we could have a top 10 paper talk in GCOS, because I think going forwards, it's a really interesting topic that gets different people's perspective. That we welcome everyone to come to Williamsburg in October.
For more information about ICOS, you can go to ic-os.org, where you'll find more information about all of our programs, including our weekly webinars, our board certification exam, and other resources that we know you'll find helpful. Thanks for joining us today, and we hope to hear from you soon.